Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. The external ear includes the auricle or pinna, which captures sound. Sound travels through the external auditory canal and hits the tympanic membrane, the eardrum. Behind this is the middle ear, containing 3 tiny bones: the malleus, the incus, and the stapes. These bones transmit sound vibrations to the oval window connecting to the inner ear, which includes the cochlea, vestibule, and semicircular canals. The cochlea converts vibrations into nerve impulses via hair cells, which then travel through the cochlear branch of the vestibulocochlear nerve to the auditory cortex in the temporal lobe. Meanwhile, the semicircular canals send information about head position and balance through the vestibular branch of the same nerve to the brainstem and cerebellum. The nose also has external and internal structures. The external nose contains the nares and nasal ala. Inside the nasal cavity, it contains the turbinates, which warm, moisten, and filter the air. The nasal septum divides the cavities into 2 sides. The sinuses, which include the frontal, ethmoid, sphenoid, and maxillary, are air-filled spaces that produce mucus and drain into the nasal cavity. Functionally, the nose provides olfaction, or smell, through receptor cells that detect airborne molecules. These signals travel via the olfactory nerve to the olfactory cortex in the brain. Moving to the pharynx, we see multiple parts: the nasopharynx, oropharynx, and laryngopharynx. These areas contain tonsils and adenoids, which are part of the immune system. The oral cavity includes the tongue, palate, uvula, teeth, and gums. The larynx, or voice box, contains the vocal cords and is responsible for sound production. The epiglottis closes off the airway during swallowing to protect the lungs. Common ENT diseases include acoustic neuroma, cerebrum impaction, cholesteatoma, hearing loss, presbycusis, labyrinthitis, mastoiditis, Meniere's disease, motion sickness, otitis externa, otitis media, ortorrhea, otosclerosis, tinnitus, and vertigo. Disorders of the sinuses, nose, and nasal cavity include allergic rhinitis, epistaxis, nasal polyps, septal deviation, sinusitis, and an upper respiratory infection. Disorders of the oral cavity and pharynx include cancer of the mouth and neck, cleft lip and palate, cold sores, glossitis, leukoplakia, pharyngitis, temporal mandibular joint syndrome, thrush, and tonsillitis. Disorders of the larynx and neck include cervical lymphadenopathy, laryngitis, and vocal cord nodules. Some common hearing tests include audiometry, brainstem auditory evoked response, the Rhine tuning fork test, the Weber tuning fork test, and tympanometry. Laboratory and radiologic tests include culture and sensitivity, a rapid strep test, a RAST, and a sinus series. Medical procedures include otoscopy. Medications include antibiotics, antihistamines, antitussives, anti-yeast drugs, corticosteroids, and decongestants. Surgical procedures include chyloplasty, cochlear implant, endoscopic sinus surgery, mastoidectomy, myringotomy, otoplasty, polypectomy, radical neck dissection, septoplasty, stapedectomy, tonsillectomy, adenoidectomy, and tympanoplasty.